You're listening to a Raconteur Studios podcast.
Hello and welcome to the After Hours Skin Clinic. I'm your host, Dr Emma Craythorne, a consultant dermatologist, and this is the space where we keep the skincare conversation going even after the clinic has closed. Now, today is National Dermatology Day, so I've got my fellow consultant dermatologist and partner in clinic, Dr Ellie Rashid, back. And she's in the studio with me to lift the lid of what it's like to really be a dermatologist. Hi, Ellie.
Hello.
We're going to talk about what the training pathway is like to becoming a dermatologist. And we're also going to talk about what life is like as a dermatologist. And then also have a thought about all those other professionals who work within the field of dermatology and what those different titles mean. How does that sound?
Sounds perfect. There's one thing I love talking about is dermatology. The other thing I love talking about is being a dermatologist.
I thought you were going to say, there's one thing I love is dermatology. I also love talking about me.
That's so true. Yes.
Shall we start with what exactly is a dermatologist? What does that term actually mean? Because you see the term dermatologist written everywhere and it doesn't always convey the exact message of what that person is. So what is the term dermatologist, consultant dermatologist? What does that mean?
So a dermatologist or consultant dermatologist is a medical doctor who has trained within the field of skin disease, how to diagnose, treat and manage skin disease. They've often gone through medical school. You have to be a doctor. And then you go through either medical training or physician training. You can actually enter specialist dermatology training through pediatric training and now surgical training. And then once you've done those pathways and you've passed your exams within medicine or surgery or pediatrics, for example, you then apply to enter dermatology specialist training. And that dermatology specialist training is a 4-year program. And at the end of that 4-year program, if you've reached all your competencies, then you can get your certificate for completion of training or CCT. And from that point onwards, you are a consultant dermatologist.
And so what did your training pathway look like? What did it look like as soon as you left school?
After school, went to college, did my A-levels, and then I went to Barts and London Medical School. Whoop, whoop. And did 5 years at medical school. I didn't do an intercalated Bachelor of Science. I just wanted to get through medical school. And then I did what was called your house officer jobs. So basically I did 4 years of medical training. So that was doing rotations through gastroenterology, cardiology, care of elderly, like all the different medical specialties, A&E, GP. But I knew I wanted to be a dermatologist in my 4th year of medical school because I had this amazing rotation in dermatology at Whipps Cross Hospital. And I just remember thinking everyone was really happy. That was the biggest thing I noticed. Everyone seems to come to work happy. They all seem to have a great time. You treat so many different types of patient from literally cradle to grave. And I thought this is definitely the specialty for me. I still really enjoyed all the medical specialties, but I love dermatology. I did a teaching fellowship in dermatology because there were no jobs in London at the time. It was so uber competitive and there were hardly ever any specialty training program jobs. And so then I did a teaching fellowship, teaching medical students from St George's University, and really enjoyed that. An amazing coach, mentor, supervisor called Chris Harland. And then applied and got a London number. So 4 years of training within Derm in London.
And then you did your PhD after that?
Yeah, so I did my PhD 3 years into my specialist training. So you had to have had a proportion of your training left to take time out of the specialist training program to do time out for research. So I applied to do a PhD with this amazing consultant, John McGrath.
So amazing.
Oh my God, he's just
Let's
an
just take a
absolute
moment
legend.
For John McGrath.
Honestly, and Gemma Malaria.
Yeah, and Gemma.
My PhD supervisors just dream supervisors. So I did my 3-year PhD at King's College London. And that was the stem cell therapy PhD. And then went back and did my final year. And then when people would ask about where do you want to be a consultant dermatologist, everyone always plays it down. They're like, no, I don't know, I haven't really thought about it ever. Whereas whenever anyone asked me, I was like, guys, in St Thomas's, that's where I'd like to work. Okay, but what if that doesn't work out? No, it has to work out. Yeah, it will. It has to. Tell me about your journey into dermatology.
So I always wanted to be a doctor from I was really tiny, or maybe it was my grandmother telling me that I wanted to be a doctor, which made me think I wanted to be a doctor. But I was always fascinated by everything to do with the human body. I mean, absolutely fascinated. I remember even being little, and there used to be a TV show on that was all about the human body, where all of the cells were represented as different people and that they were the cartoon characters. And I was filled with excitement every morning on Saturday to get up and watch this TV program. So I always wanted to be a doctor. So after my A-levels, I went to medical school in Dundee. Whoop, whoop, whoop.
See, I whooped.
Top medical school in Scotland. And the reason why I picked Dundee was because at that time, you got to see patients from year one. So this wasn't that you were, doing all of the kind of background stuff of medicine. You got to see patients straight away, and there wasn't anyone else doing that. So I wanted to go to Dundee Medical School, and it was an absolutely amazing place to be at university, because Dundee is, although it's a city, it's not that big a city, so you can find your way around it really well. And it was also really inexpensive, so I didn't run up a massive, huge student loan. But at medical school, and I think a lot of people find this now, that you don't get a lot of exposure to dermatology. I mean, I think medical students now get 1 or 2 days. It's not a lot actually seeing patients. So then we had 2 weeks in dermatology, but I didn't really like it at medical school. I really thought it was actually something that wasn't going to be for me at all. I just thought, no, it seemed a bit boring. So I left medical school with the intention that I was going to do ENT surgery. I was going to do head and neck surgery, and that's what I wanted to do. And then it was when I was in Glasgow, which is a brilliant place to do your head and neck surgery jobs, because there's a lot of head and neck cancers and a lot of head and neck injuries. It was there I actually met a dermatologist who was operating on the ear to remove a skin cancer from the ear. And we, as the head and neck surgeons, were going to be doing the repair afterwards. And I thought, oh my gosh, this is what dermatologists do. What dermatologists operate. And I spoke to him, and he said, oh, come along to my clinic. He was a Mohs surgeon. So a Mohs surgeon is somebody who removes skin cancers with, keeping things as nice and neat and tiny as possible, looking at the margins as you're removing it, so you get this highest cure rate for the removal of the skin cancer. And I thought, oh my gosh, this is what I want to do. His clinic was amazing. And so I then did a year of dermatology in Scotland. And then where is the best place that you could do your training in dermatology? And that's at the Institute of Dermatology at Guy's and St Thomas's Hospital. And so a bit like you, I said, I am going there to do my training. And it's so competitive. I mean,
it's super competitive.
So competitive. They must have felt sorry for me. But anyway,
no, amazing.
So I started my 4-year job there. And then I knew that I wanted to be a dermatology surgeon. I went into dermatology to be a dermatology surgeon. And so I did a year's fellowship afterwards in laser and surgery again at the Institute of Dermatology. And a bit like you, as soon as I'd finished all of that, I then started, the following day after finishing my fellowship and training as a consultant dermatologist there.
And that's where you wanted to work? It was literally the only place?
That was where I was working.
Yeah.
Nothing else kind of came into play. That's where it was going to be.
Yeah.
And so for those of you listening who don't know, the Institute of Dermatology, it's called the St John's Institute of Dermatology. It's where you work as a dermatologist, but you can work within your very specialist field. So as a surgical dermatologist, I get to do skin cancers and lasers. And actually, you stay very much within your niche, don't you, in these areas? And you can really dive down those rabbit holes. So it's just a wonderful place to work with amazing colleagues who all support each other, lift each other up.
I really feel like at St John's you have real experts, and it's because of the type of patient that we see. I mean, we only become expert when we've got exposure to complex patients, and we see wonderfully complex patients, and it only makes you better. And I always think that's what the advantage is of NHS medicine. You just are at the forefront of how to manage these conditions using the latest evidence, and hopefully being able to manage them with your colleagues, not necessarily just dermatology colleagues, with your other specialty colleagues. And I learned so much from gastroenterology. I do a clinic with them. I learned so much from rheumatology whenever we've got joint patients with that. I just learned so much from the others. So yeah, I love working there. I do love working there.
I think that's such a good point because actually, although we are doctors and we specialize in skin, actually skin has such a big impact on many other areas of the body. So like you say, the cardiologist might be involved with a patient, the rheumatologist might be involved with a patient. In my line of work, it's the oncologist and the plastic surgeons that are all involved with the care of patients. And you're right, it's been able to be part of this big team, which is so important as a doctor, isn't it?
Yeah. The other thing that I think is when you become a dermatologist, often that's the point, when you become a consultant dermatologist, that's the point where you then can think about doing private practice. And private practice is another way of working, and we do private practice together. And it's wonderful. I absolutely love it.
And you're really annoying, Emma.
And I don't think we should work together anymore. And private practice is wonderful, but you do work very sort of on your own. You're in that clinic room. Yeah, we don't. We're unusual because we basically pop into each other's room basically after every patient. But most people would work on their own in private practice, and I think it can be a bit of a lonely place.
Yeah, I think that's right. The grounding you get is working as part of a team, whether that's in a private practice team or especially an NHS team, really is where you just continue to learn so much more because, yes, you learn from your patients for sure, but I learn from my colleagues. I learn something new every day, although you still haven't taught me anything for a while.
I'm still waiting to learn something from you.
One day. But it is like that, isn't it? You will learn the things from your colleagues and certainly for filming the television series, The Bad Skin Clinic, because, again, of working at the Institute of Dermatology and the colleagues that you make and the support you have for each other, it's very easy to think, I've got this really complex patient. I mean, this patient has seen 15 other doctors and nobody knows what's wrong with them. And sometimes I feel like I'm the doctor of last resort. In fact, that's what Andrew Markey calls me.
He calls you. The last resort
here she
doctor.
comes, the doctor of last resort. But actually, it's because I have so many other people I can say, I think this is what this is. What do you think?
Yeah.
It's amazing having that support.
So I guess we need to talk about other specialists or other people or therapists that also deal with skincare and see patients that have skin problems and what the difference is between them and a consultant dermatologist.
Yeah, I think that's really important because everybody actually does have a role to play.
Completely.
And, I think sometimes as consultant dermatologists, it might seem a bit of a superior complex. Do you know what I mean? And it shouldn't really come across like that. It's because everybody really very much has their different roles to play. So let's break down what these terms are. So the term dermatologist, can anybody call themselves a dermatologist?
Yes, legally they can. So the term consultant dermatologist is the legally protected term. So people couldn't call themselves a consultant dermatologist without being on the specialist register. And if you wanted to check if someone is on the specialist register, you can check the GMC website and there's a little search box and you put in the person's name and then it will say that this person qualified at this point and that they have been on the specialist register from this date. So that is the best way to establish if the person that you want to see or have been seeing is a consultant dermatologist.
I do think that is important because sometimes people will think that they're seeing a dermatologist and they will treat that as a dermatology medical consultation when in fact the person might not be a dermatologist. So you just have to go to the GMC website, put in the surname of the doctor, and then it comes up with their registration number. And then it will have a thing that says, is this patient on the specialist register? And then you can see whether they are or not.
Yeah, the funniest thing I heard the other day was someone was about to give a talk and they were introducing themselves and they said, I'm a doctor. And then they said, and I have a background in dermatology. So I asked someone that was sitting next to me, I was like, oh, are they a dermatologist? I thought, don't recognise you. We're quite a small world. And it's like, no, they did a dermatology rotation. That was their background in dermatology.
Oh, but you see it all the time.
That's misleading.
So I think that's right. I think that there's a difference between somebody who isn't a dermatologist, and I think of some of the GPs that I work with at King's, they're not dermatologists, but they're GPs with a special interest in dermatology. And they know so much dermatology. They have been working in dermatology for the last 20 years alongside the team at King's, and they know a lot about dermatology. And that's a background in dermatology, or dermatology with special interest.
Yes.
Doing a course for a month, or
an online course,
or working in a department.
E-learning for healthcare module in dermatology.
Or working as part of a 4-week attachment whenever you were a junior house officer.
Yeah, a taste a week in dermatology.
Yeah, that's misleading.
Yeah, I think it's all about your intention. I think if you're trying to purposefully mislead, then that should be discouraged. But I think if you are a GP with a special interest in dermatology, you're seeing dermatology patients all the time, fair play, they're absolutely amazing. Great, carry on. If you're a qualified doctor and you have a particular interest in skin disease, then often they will call themselves a skin doctor or a cosmetic dermatologist.
A skin specialist, I see quite a lot.
Yeah, that
skin
comes
doctor,
out.
skin specialist. Cosmetic dermatologist is a very common one that you would see, which is obviously not a dermatologist.
Yes.
In most cases, it's not a dermatologist.
Aesthetics doctor. So again, these are often qualified doctors, but have then gone into the aesthetics branch and predominantly do cosmetic work. But they haven't done that specialist training and got all their competencies for becoming a consultant dermatologist.
I think it's just frustrating if somebody is using the term dermatologist to make money for themselves. I think that is probably the bit that is the annoying part, because it can mislead people who are coming to them. And if you're using it as a marketing term, the term dermatology, and you're not actually a dermatologist, I feel like that is quite wrong.
Yeah, it's unethical.
Yeah. And if you put into something like Google, for example, which I had to whenever I was giving a talk for the JCCP, which is our Joint Council for Cosmetic Practitioners, the first 5 searches that came up whenever it said cosmetic dermatologist, none of them were actually dermatologists.
Yeah.
Have you come across that where
so got such a funny story. I went to go and see this private clinic when I was thinking about doing private, and the clinic manager showed me around, and then she said, it'd be really great to have a dermatologist because our current dermatologist is leaving. And then I said, who's the current dermatologist? Because I couldn't remember seeing that on the website. And then they gave me the name. I said, gosh, I don't recognise that name. So then I searched, and it was a qualified doctor, but wasn't someone who was a dermatologist, wasn't on the specialist register. And this clinic manager who'd worked with this individual for many years completely assumed that she was a consultant dermatologist.
Really?
And the other funny story, this is even better. I was with a friend of a friend, and then she said, I was thinking of being a dermatologist. And I said, amazing. Which medical school are you thinking of applying for? And then she went, medical school? What are you thinking of doing? I said, no, you have to be a doctor to be a dermatologist. She goes, no, I can't bother for that. Just totally changed her career trajectory.
Yes. So to be a consultant dermatologist, let's work it out. It's 5 years at medical school.
Yeah.
It's 2 years now as a junior, and then another 2 years. Is it 4 years in total?
So 4 years. 4 years, whether you do that in physician training, like core medical training, or physician training, it's called now.
I only hesitated there because I'm now so old that they've changed the training pathway so many times. So it's 5 and then 2 and 2, so that's 9. And then you'll do your dermatology specialist training, which is another 4 years. So that's 13. And then for good measure, you may well do a fellowship or an MD, which you really need to do if you want to work in a teaching hospital. Really.
Yeah, we're a
cases.
Small specialty. We have to drive our specialty forward. And really, the only way of doing that is by conducting research, doing PhDs, MDs, fellowships, being the best, being the absolute best at your job.
So that's 13 years before you're a consultant dermatologist.
Yeah.
I quickly want to say that if you're enjoying these episodes and like what we stand for here at the After Hours Skin Clinic, then please do me a favour and click subscribe. We're just starting out and it really helps us grow and reach more people. My team and I would really appreciate your support. Anyway, enough of that and on with the episode. But I do think it's important not to trivialise all of the people that work in other aspects of the skin health. Some of the energy-based devices, some of the peels, some of the skin health treatments, some of the skincare treatments that we do, facials, a lot of these treatments, you wouldn't be going to a consultant dermatologist.
You want to go to the person that does this day in, day out, is really comfortable doing it. And that's the person that you want to go to. A facialist or an esthetician would be very good at looking after someone's skin, establishing a skincare routine. They'd be really good at doing that. Would they be really good at diagnosing the over 3,000 different dermatological skin, hair and nail disorders? No, but that's not what their interest is. That's not what they're trained to do.
And actually as well, some of the energy-based devices or laser treatments that we do, if it's in the right safe pair of hands and those devices are all controlled in the right way, so that is the caveat, it's actually better to see somebody who's trained in it who's not a consultant dermatologist in some cases, because some of these treatments actually need multiple treatments. And to see a consultant dermatologist to have it done all the time is actually really quite expensive and not completely necessary. Obviously, the more aggressive laser treatments that we do, it's much better to be in those hands. But for some of these ones that require repeated treatments, appropriately trained nurses and appropriately trained estheticians and appropriately trained GPs with a special interest and appropriately trained skin specialist doctors.
They just were doing it day in, day out.
Yeah.
They will have loads of experience. We also need to go to someone that you know will know how to manage complications.
I think that's so important because it's not just about delivering the treatment or the care. It is what to do when things go wrong.
Yeah.
And, having the kind of training that you get as a doctor, as a nurse, to be able to understand how to manage people, patients, whenever things go wrong, but also who to contact, who to call, how to act immediately. Those things are kind of paramount.
I always say this, I could probably teach my 3-year-old to point a laser and press a button.
Yeah.
I mean, it's not that difficult, but it's all about the nuance of the settings that you're going to use, how you're going to use it, and what happens if things go wrong, how you would adjust your practice. If it's not just, because it's not like a cookie cutter model where you would do exactly the same settings on every single person. How would you adjust it depending on the person that's in front of you? And
all of those safety things that you put in place before to try and make sure things don't go wrong, all of that's built up with experience and knowledge. Yeah. And then if things do go wrong, I always think the measure really of a very good clinician is not what they're doing when things go right, it's how they handle it if things go wrong.
Totally agree.
They're always the doctors that I've worked with who I've just really respected the most whenever something has gone wrong and how did they handle it. So I suppose to move on to the next stage then, because you're the training programme director now at St John's Institute of Dermatology for all of the dermatology fellows that come through. So what does that training programme look like now for them?
Yeah, so being training programme director, I do it alongside a colleague of mine, and we look after the trainees within Guy's and St John's, so St John's Institute of Dermatology. And essentially our role is, there's an element of a pastoral role to it, but our main role is to ensure that the trainees achieve all of the competencies according to the dermatology curriculum in order to become a consultant dermatologist. Also, all the specialist skills that they would learn, they need to be able to diagnose, treat, manage a patient clinic list, be able to ascertain important information, see acute dermatology as in emergency dermatology, look after inpatients on the ward. So we need to make sure that they are exposed to all of those different scenarios in order to tick off every single one of those competencies, so that at the end we can review that portfolio of competencies and say that they have met the necessary requirement to complete their training.
Gosh,
it's a really big job.
It's a big job, but a bit like what we talked about with the complications. When things go wrong, it's a big job as well, isn't it?
Yeah.
Whenever you've got to support people who are needing extra support.
Completely. Emma, what's one of the most amazing things you've seen in your time as a consultant dermatologist?
When I wasn't even actually a dermatologist, I was working in oncology in Edinburgh in the cancer centre, and part of my rotation was in skin. If the melanoma had moved from just the skin to the lymph nodes or other parts of the body, at that time, there weren't really any successful treatments for it. And so the inpatients that we would have had, and this would have been around about 2004, 5, those patients didn't do very well. And it was incredibly sad because most of the patients were quite young, otherwise had been very well until this had happened to them. And very sadly, they pretty much mostly died. And since then, there's been new advancements in melanoma care. So continuing to work then in that field and see patients who now were in a similar situation that many of these patients were when I first started out, but are now using immunotherapy agents. So these are targeted treatments that target particular pathways of the immune system to make sure that those melanoma cells get under control and they're killed essentially. And then they allow the patient to live with the disease or essentially have a curative outcome. So I think that has probably been the biggest transformation for me and the most amazing thing that I've seen in dermatology over my time as a dermatologist, this increase in these new targeted therapies and the immunotherapies.
Absolutely same. And then these immunotherapies, we use these targeted biologic therapies where we suppress these very specific pathways of our immune system to treat inflammatory skin conditions as well. So now things like psoriasis, eczema, whereas before you would get admitted to the ward, have loads of steroid cream, maybe UV therapy like phototherapy. Now we've got just these amazing treatments that work incredibly well where the person wouldn't even know that they had that inflammatory condition anymore.
I know. I mean, it's really unbelievable. So at the very beginning, we had 3-4 wards worth of patients, all inpatients, all having topical treatment applied to them, all being wrapped up in bandages and really, really thick, heavy creams, and inpatients for months on end.
Yeah.
Whereas now, most hospitals do not have any inpatients in dermatology.
Yeah, which is only a good thing.
Yeah, it is only a good thing.
Yeah.
What would you say in dermatology over your time has been your biggest achievement?
You know what this is going to be.
Yeah, working with me.
My private practice with Dr. Emma Craythorne. Biggest achievement, absolutely, because it took blood, sweat and tears to get through. It was 100% my PhD.
Your PhD?
Oh, yeah. It was amazing, wonderful. I learned so many skills, made so many friends, learned so many techniques. But my gosh, it was heartbreaking when an experiment didn't go well. It's heartbreaking when stuff you spent months and months and months on doesn't work out the way that you thought it's going to work. And everyone goes, that's the nature of a PhD. You're like, I can't take it though. It's not the nature of my personality.
Good stuff.
Yeah, I just want things to go well. So yeah, by far the thing that I'm the most proud of is achieving my PhD.
Yeah, I'm very proud of you for that too.
Oh, thank you, darling.
It's really such an achievement.
What are you most excited about in the future of dermatology?
I think in the future of dermatology is probably going to be this pretty similar to all branches of medicine, is this idea of personalisation.
Absolutely.
You know, before we would be giving somebody with a specific skin condition a drug, and everybody who had that skin condition just got that drug. But actually, some people, they don't respond to that drug or actually have a toxic outcome as a consequence of that drug. So I think now as we start to understand phenotypes of how people look, how people behave, how people act, and what their genotypes are, so what genes they have, what their epigenetics are like, I think we're able to harness all of that information now so that people will be able to get to the treatment that works quickly, effectively for them. And I mean, that's even true when we think about topical skincare, isn't it?
Yeah, even for topical skincare now, rather than everyone having the same formulation off the shelf, we're now personalising it to their specific skincare concerns, which ingredients will work best for them, which other ingredients to support those active medical grade ingredients will work best for them, and then we can really personalise their topical skincare formulation for their specific needs.
Yeah, I think that's right, because we know if somebody's got acne, the number one ingredient that you can treat acne with is a medicine treatment topical called tretinoin. And everybody who has acne typically will be on tretinoin, no matter what kind of demographic background, whatever they are. However, not everybody can tolerate tretinoin in the same way. And so, you know, the 45-year-old woman with acne will tolerate delivery of tretinoin in a different kind of formulation or base than the 16-year-old boy with acne. And I think it's about being able to personalise that base and personalise the way a drug is delivered is going to be key. And then you can just kind of translate that right across the board with all aspects of dermatology. If you have psoriasis, what's going to be the most important treatment or appropriate treatment for you? If you have HS, what is going to be the most appropriate treatment for you? And I think that that's the information that we're going to be getting over the next decade or so, this real personalisation of care.
Can you imagine if a patient walked in and you just did a little swab, established what their genotype is, looked at them to establish their phenotype, and then you could go, right, yeah, based on this information, this drug is going to be the one that works for you.
Yeah, this is the one.
Straight to the drug that will actually work.
Yeah, and that is happening.
It's happening. It will happen. Absolutely.
So that's it for today at the After Hours Skin Clinic. I love chatting with you again, Ellie.
I absolutely love being here.
It's like a little trip down memory lane whenever you think about your career, isn't it?
Yeah, and we love talking about ourselves.
If you're enjoying these episodes, give us a follow, rate the show and share it with your friends. It really helps us grow and reach more people. If you've got some suggestions for topics or want to send us a question, we read all of them. Reach out on Instagram or send us an email. The details are all in the show notes. That's goodbye from us. Take care of your skin, wear your SPF, and we'll see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.